Good morning, my name is Rebecca and I'm going to be your nurse today. How are you?
I'm doing good.
Good. Now can I get you to verify your name?
Dora Guerra,
Okay, Miss Dora, and how old are you?
52.
Alrighty. Now, Miss Dora, you are in for a general survey, so it's just going to be an assessment of your head and neck. Is that okay?
Sure.
Okay. So I'm going to begin by letting you know if at any time during the assessment you feel comfortable or any pain, just let me know.
Okay.
Okay. So I'm just going to ask you just a few questions. I've already asked you your name and age. And do you know who the president is?
Trump.
Okay. Do you know who the formal president is?
Biden.
Alrighty. And do you know what day of the week it is?
It's Monday.
Okay. Very good. And would you say you have access to 3 meals a day?
I do.
Okay. So Ms. Dora, your BMI, which is your body mass index, was appropriate for your height and weight, so that is good. I noticed as you walked in, your mobility was nice and steady, nice and straight. I didn't notice any use of like a walker or cane. Do you use any of those?
No, I don't.
Okay. I also did not notice any physical deformities. Do you have any of those?
No.
Okay. Your posture is nice and straight. That is good. As far as your clothing, it's nice and clean, so it does demonstrate you have good personal hygiene. Okay. And what is English your primary language?
It is.
Okay, very good. And how about your mood? Would you say you are happy today?
Yes.
Okay, very good. And would you say that's a normal for you?
Yes, it is.
All right, Ms. Dora. Okay. So I'm going to begin the assessment part. I'm just going to get my hand. I'm just going to clean my hands. And then we'll begin the assessment part. And just a reminder, if at any time you feel uncomfortable or any pain, just let me know, okay?
Okay.
Alrighty, so I'm going to begin by assessing your cranium, which is your head, okay?
Alright.
So as I look over your cranium, I'm just going to be looking for any lumps, bumps, or bruises. I'm looking at the size and shape. It is symmetrical and round, okay? I'm going to be looking at your scalp. Okay. I'm looking for any redness, flakiness, or signs of infestation. I do not see any. I'm looking at your hair color. Your hair color is dark and brown. Your hair is thin, and it is evenly distributed. Alright, Ms. Dora. Okay, and as I press on your scalp, do you have any tenderness?
No, I don't.
Okay. Alright, very good. Alright, Ms. Dora. So from there, I'm going to move down to your face, okay? Now I'm going to begin with your eyes. I'm looking just for any redness, swelling, or drainage. Okay, I'm looking to make sure they are symmetrical. They are symmetrical. I do not notice any redness, swelling, or discharge. Can I get you to close your eyes? Okay, I'm looking at your eyebrows, your eyelids, your eyelashes. Everything is symmetrical. Very good. You can open your eyes. Okay. Alrighty, Ms. Dora. So I'm going to go ahead and get you to look straight at me. As you do, I'm going to flash my pen light. I'm going to shine some light in your eyes, okay? Alrighty. Very good. Great. Alright, Ms. Dora. Can I get you to just look at my pen light? And then I'll get you to look at the wall behind me. And look back at my pen light. Very good. Okay, so Ms. Dora, your eyes are equal and round and reactive to light and accommodation, so that is good, okay? I'm going to go ahead and press on your sinuses. So I'm going to press right here. These are your frontal sinuses. This is your maxillary sinuses right here, just slightly below your cheekbone. Do you have any tenderness?
No.
Okay, very good. Alrighty, then I'm going to go ahead and just be looking at your nose. I'm just looking for any redness, swelling, or drainage, discharge node present, and I do not see any. I'm going to be looking at your ears. Okay. I do not see any redness, swelling, or discharge. Now, do you happen to have any tenderness as I push?
No.
Okay. Very good. We're ready, Ms. Dora. So then I'm going to look at your lips. Your lips are pink and moist, symmetrical. So your nose, your eyes, your lips are symmetrical. Your ears, your lips are symmetrical. No cracks or lesions present. Okay. From there, I'm just going to move down to your neck. Okay, for your neck, I'm just looking for any lumps, bumps, or bruises, or any visible pulsations. I do not notice any. Okay, I'm going to be looking at your trachea. It is nice and midline. Okay, so you can relax. Okay. Alrighty, so I'm going to begin by looking at your feeling over your lymph nodes. Okay, so as I do, I'm going to be calling them out, and I'm just going to be rolling my fingers over them. Okay.
Okay.
Alrighty. So we're going to begin by touching your pre-auricular, your pre-auriculars. Okay. They're right here in front of your ears.
Mm-hmm.
Then behind your ears, you have your post-auricular. Okay. Alrighty, Ms. Dora. Then right here is going to be your juxtadigastric lymph nodes. These are going to be your tonsils, okay?
Okay.
Right here underneath your chin, you're going to have your submandibular lymph nodes. Very good. And right here in the middle is going to be your submental lymph node, okay? Alrighty, you can relax. Alright, and then I'm going to go ahead and move on to your posterior cervical. Okay. Your superficial cervical. Right here on the sides. Okay. And then your deep cervical is right here in the middle. In the front. Okay, very good. Okay, so can I get you to just shrug your shoulders? And then I'm going to be filling over your superficial clavicular. Okay, any tenderness?
No.
Okay, can we look? Alright, Miss Dora, so I'm just going to step behind you. And then I'm going to be examining your thyroid, okay?
Okay.
I'm going to place my fingers here, okay? Now, can I get you to tilt your head to the right and then go ahead and swallow? Very good. And you can tilt your head to the left and swallow. Very good. Alrighty, Ms. Dora, did you have any tenderness?
No.
Okay. And do you have any questions for me?
No, I don't.
Alrighty, Ms. Dora. Well, this concludes our general survey, and I just want to thank you for your time, okay?
Thank you.
Thank you. Have a good day.
You too.
Okay. So I'm going to begin my verbal report over my general survey. My patient is AAO times 3, consumes a regular diet that consists of meats, fruits, and vegetables. Her BMI is 24, indicating a healthy range. Her posture was erect. Her gait was smooth and steady. She describes today's mood as happy and indicates this is normal for her. Describes her mood as happy and indicates this is normal for her. Her speech is clear and articulate. English is her primary language. She was dressed appropriately for the weather. Her clothing is nice and clean with no body odor present. And then I began my assessment. I began with assessing her cranium. Her cranium was smooth and non-tender. Her scalp was intact with no redness or flakiness present. Her hair was thin, dark brown, and evenly distributed. Her eyes were symmetrical with no redness, swelling, or discharge present. Symmetrical. Her nose was symmetrical with no redness, swelling, or discharge present. Her sinuses were non-tender. Her ears were symmetrical with no tenderness or redness, swelling, or discharge present. Her lips were symmetrical, pink and moist, no cracks or lesions present, slight droopiness. Her neck was symmetrical with no visible pulsations. Her trachea was midline. Her lymph nodes were palpable and non-tender, and her thyroid was palpable and non-tender. And this concludes my verbal report over my general assessment. Thank you.